Hey you guys, it is your girl AP and welcome to my channel. Hey guys, it's your girl AP and I'm back. I know it's been a moment since I've come to create any YouTube content, but if I'm completely honest, I'm not really content creating these days. So this video is going to be just like a catch-all of what's going on. You do know that, well, if you're subscribed to me, which thank you, A-Team. But I mostly come here and talk about a lot of health things, mental and physical. And so today I just want to kind of catch up on where I'm at, what I'm doing with my journey, and where I foresee things going. So grab yourself a little drink. I don't care if it's alcohol or alcohol free, or a little coffee, a little tea, whatever your beverage of choice. Sit down and let's sip and chat. All right. So first things first. You guys know that I talk a lot here about the duodenal switch, or also pronounced the duodenal switch surgery, which I had in August 2021. So next month, because it's July 1st right now, but next month I will be heading into year 2 of being post-op. And it's been wildly insane to see how much my life has changed in 2 years, but it's been great. I've been as transparent as I can be about the ups and downs of the journey. I think a lot of people anticipate more negative sides to having this type of surgery. So I get a lot of questions about the negative aspects, but the God's honest truth is any quote-unquote negative facets of this surgery are so low-key in comparison to anything I was experiencing before I had the surgery. I think I talked about it here, being in hyperthyroid modes, because I have no thyroid and my thyroid hormone is controlled with medication. And a few months back, I was going through it and I had been in hyperthyroid mode for a while. So it was wreaking havoc on my body, and I had an endocrinologist who wasn't really, I don't really know what the proper term is. She wasn't that, she wasn't that aggressive or assertive in trying to treat it, and she transitioned out of the practice and a new endocrinologist came in, and she was just kind of like, I don't think it's that. And so she wouldn't listen to me. She didn't want to titrate my dosage more. It was just a whole hot mess. I ended up in the hospital because I passed out in Chattahoochee Food Works at Philly Cheesesteaks. Shout out to all the people who collected me off the floor and didn't take video of it. But since then I got a new endocrinologist under a new practice. I've been on 100 micrograms of Tirosint. And if you're in the thyroid community, you know. And thus far I'm doing okay. Because I had stopped taking my thyroid meds, and until my PCP was able to write me a new prescription, by the time I got to an endo, I was in hypo mode. So I went from being hyper to hypo. My TSH was a 24. So my new endo was immediately like, oh yeah, we gotta get your meds up. We gotta get this up, but not too high. So currently, like I said, I've been on 100 micrograms. I'm due for lab work at the end of July, so we'll see how I'm doing. But physically, I feel fine. My sleep has returned to normal. I'm not dealing with heart palpitations or anything like that. She was a little fearful that I might gain weight. I don't really know how that works with me having had duodenal switch. In the past, I would put on weight when I was in hypo mode. I've been smooth between 225, 230 when I'm PMSing for at least 6 months now. I think that's kind of where I'm going to plateau. I think we're in the 220 range, and that's where I'm going to stay. And I'm perfectly fine with that. I know a lot of people get weight loss surgery and their goal is to be out of the 200s. That's never my goal. My fat mass, my muscle mass is great. And I know that because I step on a machine and get scanned all the time. My bone density is great. So to me, the weight is just a number. It's not a reflection of my health. So I'm not like, oh, I have to get out of the 200s. I'm good. I feel good here. I look good here, in my opinion. So you guys won't really hear me talk too much more about trying to actively lose weight. I feel like I'm just ready to be in maintenance mode, and my body is comfortable here. With that being said, Someone requested on my last Wild No Switch video if I would talk about the foods that upset my digestive tract. So I'm going to briefly touch on that because honestly, the list is so short. There are a lot of DS patients who have this surgery and they struggle with food choices. In the beginning, it took a while because, my body was healing. It took a while for me to be like, okay, I can eat this and be fine. But once I got to like the 6 month mark, the only thing that took a while was like raw vegetables. But I can pretty much eat normal. It's not really too much that upsets my digestive tract, honestly. And even though I had my gallbladder removed in November, I'm still not like running to the bathroom. I'm not dumping. There's things that I think tend to make me gassy, like processed sugar definitely is one of those things. So if I have a piece of candy or a piece of cake, no matter how small it is or whatever, like that is something that will definitely make me gassy. And when I'm backed up and I need to go, I will have that candy or that little scoop of ice cream and they'll send me right to the bathroom. But other than that, there's really not much that upsets my stomach. I'm sorry, I don't have more to give on that. I don't know that my experience is all that unique because being in the DS support group on Facebook, I have access to other DS patients who are long-term vets, and a lot of them kind of have similar stories to mine where they're not triggered by the things that they eat. I find that when I PMS though, like I am more prone to bloating and water retention around that time, but that's always the case. You know what I mean? So it's not like eating something specific is triggering those things or making my stomach upset. I'm still eating high protein. I eat a lot of protein. I throw complex carbs in there every now and then when I have the room for it in my belly. I try to keep up with my greens and my vegetables. But off the top of my head, I really cannot think of any foods that like are sending me to see the Lord. Like it's just not been my experience. So I'm sorry that I don't have a long list of things. I would say processed sugar is probably like the only thing that sends me anywhere close to feeling like blah. Because other than that, like I eat fairly normally, frequently, but normally. And so it's not something that I've had to worry about thus far. And that could change. But as of now, at almost 2 years out, it's kind of like what it is. Okay, so I know I talked about at some point I was pursuing skin removal, but after a couple of consults with surgeons here in the Atlanta metro area, I learned that skin removal for someone like myself is a bit more complicated. I've lost 230 pounds, and what I learned is when you are larger, I was 500 pounds at some point, your body creates new veins and cardiovascular pathways in the body to sustain that weight. And so that artery work and veins or whatever, I'm not using the proper terms here, but I don't think I am, but your cardiovascular system is a little bit more extensive. Is it cardiovascular? Is that the term for the veins and arteries in the body? I don't know. And I should. I was a CNA and a medical assistant. At any rate, the body has created more to sustain that weight. So after the weight loss, it doesn't go away, which means I'm more prone to blood loss through skin removal surgery, and it becomes a way more complicated process than someone who's just, going to get a tummy tuck or, wants to get a little work done. It's not that simple. And a lot of plastic surgeons not board certified to do skin removal. And that makes my situation more complicated. A lot of the top surgeons in the Atlanta metro area, plastic surgeons, they operate out of surgical suites or boutiques, and they're not, affiliated with hospitals. And so I had a really blunt doctor. She was really great, Dr. Alderman, who just told me like, yeah, your case is unique. That amount of weight loss, like you've got excessive amount of skin, it's going to be more complicated. You're going to need to be in a hospital setting. And unfortunately, in the state of Georgia, there are not any plastic surgeons known to be board certified, not accredited, but board certified for that kind of skin removal. And my goal is like the arms, belly. That's really my biggest thing. There is a doctor in Pennsylvania whom I have an interest in having a consult with eventually. But the reality is my insurance is not going to cover skin removal. It's just, it's considered cosmetic to them. And unless I can prove irritation and fungus and all that other stuff, which I really can't since the beginning of my surgery, unless I can find a backdoor way, it's going to have to be out of pocket. So I'm not in a rush. And really what trumps skin removal is dental work. Because right now, I'm looking at a remaining $8,000 to the dental work I've already started getting. This is so good. My husband made this. He is the GOAT. Yeah, let's get into this. So a few years back, I think 2017, I started sharing on my blog my dental journey. A lot of people make you feel bad about having bad teeth, and it's like, I don't know, people are just trash. That's just my opinion. We will find ways to try to make people feel bad about things that they really aren't in control of. So I've had a total of 9 teeth removed, I believe, total over the last few years. My teeth started breaking years ago. At first I thought it was because I was a cigarette smoker, but I was told no, cigarette smoke causes gum disease and not teeth damage. It can stain your teeth, but it doesn't have anything to do with the makeup of your teeth. And so they would break, and I tried a couple times to get a root canal, but there's just something that doesn't sit right with me with leaving a dead part of the body. I mean, a dead part of your body inside your body. Like dentistry is the only medicine practice that will leave a dead something in your body. I can't get behind that. And then when I started learning that could be linked to autoimmune disease, I was just like, this ain't for me. Pull them bad boys out. Take them out. So over the years, I had my wisdoms removed and a couple. And I'm going to show y'all. So you can really behind there. This is my most recent one. Here. I think that's it. Yeah, I just let y'all open my mouth. The vulnerability that I'm sharing with y'all right now. But I learned that I had gum disease at some point. And they said that came from when I started having my teeth removed. It made me more susceptible to having gum bacteria build up underneath the gum line where I can't see. So they were like at my most recent appointment, she's like, you have clean teeth from what we can tell. They're, the teeth that you do have are great, but you have some bone loss from when your teeth were removed. You had some gum disease, so they had to do a deep clean, treat it. And of course I was feeling some type of way because there was parts of my life where I was going to get my teeth cleaned, but I was like, well, I can't afford all the stuff that they always want you to get. And so it was because my dental insurance was crap for a while. And it's still, honestly, my dental insurance is still crap. I've never had great dental insurance. But I've just reached a point where I'm ready to just take care of all of it. So right now, after that tooth extraction, I've got fillings in a couple of teeth up here. I have one more coming this month. The next step in this process is they want to shift my teeth back to where they belong. I've always had a gap. I love my gap. And I've never been ashamed of my gap. But in order for me to be fitted for partials or implants, I'm leaning towards partial because honestly, they're more affordable. They have to shift the teeth before they can do a mold to fit me for partials. And Invisalign by itself is super expensive, but I don't want metal mouth. I don't want wire braces. I'm 38 years old. I have no desire to walk around with a mouth full of metal, so I'm going to get the Invisalign. After I've gone through my Invisalign process, I will then be fitted and molded for partials and bridges or whatever else they're going to do, and that's costly. And not to mention just regular maintenance every 4 months. So when I started this process, the total was like 10,000, whatever. I'm at like the 8,000 mark left. I did get some dental credit. So I'm going to be using that to pay for it. That's the God's honest truth. But looking at 10K of dentistry feels a lot more of a wiser investment to me at this point than skin removal. And so I'm prioritizing my dental health over, you know, skin removal. And dental health is actually linked to Alzheimer's and dementia. And knowing that my mom has Lewy body dementia, the women in my mom's family have all dealt with some form of dementia. And on my dad's side, like genetically, I'm probably predisposed to it. I've had the 23andMe test that absolutely says I'm predisposed to early onset Alzheimer. I don't want to do anything that's going to like get me there sooner. So I want to take care of my dental aspect of my health before I do skin removal. And as much as I've talked about wanting skin removal, the God's honest truth is it scares me. Doing my research, yeah, like the aftermath, yeah, you look great, whatever, but I don't know if it's enough for me to go under the knife again. I'm mobile. The skin isn't irritating me. Do I like the way it looks all the time in clothes? No. There's certain things I want to wear that I just, like the skin just falls out. And, it's just kind of annoying. But when I look at the grand scheme of things, I'm mobile. I can exercise. I'm moving. I'm dancing. Not out of breath taking the stairs. Like the quality of my life is so much better that I don't know that it's worth risking some major surgeries to get the skin removed. It's kind of like my battle scars. It reminds me of what I came from and to where I'm at now. I don't know that I'll pursue that because just one procedure alone, the arms, is like $16,000. And that's just exorbitant. And do I want to go into debt for plastic surgery? No. I don't even have crazy amounts of student loans, y'all. Like, I was so meticulous about, like, my education. Like, I don't have a bachelor's. I did certificated programs because I wanted the meat and potatoes of my education. I didn't want to go take a psych class and all these unnecessary classes and spend hundreds of $1,000s on school and education because it just wasn't, I didn't think it was worth it. So if I didn't do it for my education because I didn't want to be in debt, I don't want to do it. I don't want to do it for plastic surgery. That's where I'm at right now with everything. So while I'm not keen on the idea of spending 10K on getting my mouth fixed, like it's just a far more credible investment to me than skin removal is. So for now, my plastic surgery journey has come to an end. I don't know that I'll resume it at any point. Maybe I will if I come into some more money but my skin isn't stopping my quality of life. Does it have an impact on me mentally? Yes, to a degree, but I think this whole journey has, because there's no way your body morphs in such a significant and rapid manner and you walk out of this without any impact on your mental health. But that's what therapy is for. So I'm going to do that before I go spend thousands of dollars trying to fix something that, I might get and still not be happy with. I just, that's just putting things into perspective for me. That's no knock or no judgment on anybody else who's moved forward with those things. Do what you can do when you can do it within the means of what you have. For me, I just don't have it like that. I don't know who y'all think I am, but I'm not that girl. So I'm going to focus on the dentistry. But yeah, that's it. Those are my updates. I'm sorry, I don't have anything more fantastical to talk about. Oh, wait. It's heavily on prayer and also working in harmony with my prayers and getting mental health therapy and getting physical therapy and learning how to work out and learning that God is not separate from medicine. It's not a sin. And I needed both of those things to help me be whole. And I'm just grateful that I even had the access to it, and that from the time I left my job and went out on disability, I was able to get Social Security on the first try when so many people are not able to. My family didn't experience a financial hit because mom had to go out of work, and that's a blessing in itself. And during that time, I was allowed the space to grow mentally and emotionally. And it put me in a better position to be able to be prepared for bariatric surgery when it was my time, and to be prepared for hip replacement when it was my time. So I choose to focus on the highlights of that experience, and to always, always practice gratitude for where I'm at right now. I don't want to be that person. I'm going to end it here because I feel myself getting emotional, and I want to go cuddle up with Bear and just bask in his love. But yeah, that's it. That's the scoop for today. I hope this video was what some of you were looking for. I'll be back. I definitely want to get back to planning out content and get back to writing. That's really my first love, and I've just been trying to honor myself, though. I've been at my job for a little over a year now, and I really had to give myself grace to adjust to a full-time job again. And creating content is just not at the forefront of things. I got spiritual goals that I'm trying to accomplish, and then, of course, at work and things like that. So content creating has to be at the top of my list. Do I still love writing? Absolutely. Do I still love coming here to talk about health and mental health? Absolutely. But I wanted to prioritize myself and my needs. So that meant that something had to take a hit. And if anything was going to take a hit, it was going to be content, because it's not my first love. Something I enjoy, but not my first love. I am excited to announce that I will be participating in the Dear Skinny Friend. I'll drop some information about that down below come August. So yeah, there's some things in the work. I haven't disappeared. I'm still doing, things on the side, but just know that I'm working on me, and that is never going to stop. And so that may mean that I'm not an influencer, and I love telling y'all that. I love telling Instagram that. I love telling TikTok that. People don't listen to me, but that's just the reality. I'm not an influencer. I'm a person, and I'm not in this rat race. I don't see it the way a lot of people see it. So when you see me, you see me. When you don't, you don't. Just know that I'm working on bettering myself on all levels, and that's the most important part. What you don't see, what I don't curate for online, is still happening in real life. Thank you so much for joining me. I'm sorry I got emotional with y'all, but your girl is doing well. And I can't wait to be able to come back and chat some more about some other things that I have on my mind. But for now, until next time, y'all, bye.